There's a lot of questions around hospitals and readiness, and I'm really under these circumstances proud that Jersey City has really been at the forefront over the last couple weeks on policies, really pushing them on many fronts and being the first nationally, whether it was our first to be the nightclubs and restaurant restrictions or some common sense things around supermarkets to help residents. We've been working very closely with our hospitals here in Jersey City. We have two major hospitals to take steps in order to make sure that we're prepared for the increase that we expect. We're currently at 25 positive cases and 38 still pending from CDC. That's close to a 100% increase over the last day, and we expect that trend to continue. One of the things that we've learned is that we need to be protecting the front line and the healthcare professionals as much as we need to be protecting the public. Here, we are one of the first in the state to kind of set up a protocol and procedure to make sure that the increase in patients coming through keep them safe and the healthcare providers safe as well. And so I want to turn it over to Marie Duffy, the Chief Hospital Executive, to speak to this, and then we're going to have the Chief Medical Officer to walk you through what the procedure is going to be going forward for somebody who thinks that they're potentially COVID-19 positive and how we're going to admit them into the hospital going forward. So, Marie.
Thank you, Mayor. Good afternoon, everyone. So I want to first thank the mayor and our other elected officials, as well as his staff, for the continued support for the hospitals and all the healthcare workers that are on the front lines, taking care of all the patients and their community. Today, we wanted to share with you some of the extra steps as the pandemic is upon us. We wanted to share with you the extra steps that the hospital is taking to help continue to protect our patients that are in the hospital, as well as our hospital staff as well. This tent behind me that you can see is what we call the ED triage tent. And this main purpose for this tent is really to protect both the patients that are coming through, as well as the patients that are already inside, as well as our staff ourselves. I have details of the tent and the trailer here, how that works, but I could provide that later for people that have questions, and we will share that. But I do want to take this opportunity to thank all our hospital staff, as well as all the healthcare workers that are battling this disease every day and being on the front lines. They are our heroes, and I want to thank them for continuing for their dedication and support throughout this process, and as we care for our patients, our community, as well as ourselves. Thank you.
Okay. Thank you. I'm going to bring up Dr. Woods, who is Tucker Woods, who is the Chief Medical Officer for CarePoint, and he could speak through the process, how you get screened initially, how they communicate through kind of like a car wash flap system, so to speak, and then where they get entered in for a chest x-ray, how that works, where they go from there, how they get diagnosed with the wristbands. We are trying to make sure that this is as orderly as possible. After we explain that, we will open it up to questions and comments. I'm sure some of you have questions around ventilators and beds and all of those. Happy to handle those as well, but we'll speak to what we're doing here right now. I'll turn it over to Tucker Woods.
Good afternoon, everybody. So I'm Dr. Tucker Woods. I'm the Chief Medical Officer here at Christ Hospital, and I want to thank Mayor Fulop for his support. When you build a tent like this, it's a team effort, and it requires inspections, approval by the Fire Prevention Department, and Mayor Fulop has been very supportive, and we thank him for that. So in terms of the purpose of the tent, it has multi-purposes. It's to screen any ER patient that's entering the building. And so this way, if somebody we think they do have COVID-19 and they're healthy, they can be discharged home, isolated at home, we can actually treat them right there in the tent and then discharge them from the tent. And this prevents infectious patients from entering the hospital, because one of the concerns with many viruses, many epidemics, is 35 to 50% of healthcare providers will get themselves infected. So this way we can prevent that spread of infection inside the hospital. That will also help protect our patients as well. Another purpose of the tent is all hospitals are facing a shortage of PPE, so if we have a core team in the tent treating and releasing these patients, we can help preserve our masks, our gloves, gowns, etc. Also, if we have surges in volume, now we have more space to care for these patients, because some countries have seen huge surges in volume, and now we have increased capacity, so we don't face a supply and demand mismatch. And lastly, this helps protect, like I said, Marie said, to help protect the frontline staff and also to help protect our patients. And so the process basically is anybody with an ER complaint, they'll get screened first inside the trailer behind me. And so if somebody says, oh, I cut my arm, I need stitches, we'll screen that patient. We'll actually take their temperature, because maybe they fell and they hurt their arm because they're carrying their son or child who's got COVID-19. So we'll screen them, make sure they don't have a temperature. And then if the staff feels that they do not have any risk factors for COVID-19, then they'll go inside our green zone, if you will. They'll go right inside of the emergency department. If the patient's quite sick, they'll get screened here, and if the ER staff feel that they might have COVID and they might need admission, they'll go through the side door. We have a designated red zone, if you will, and the staff will take care of, the core team will take care of the patient in that area. And lastly, I think the more common scenario for most COVID patients is most of them do quite well at home. And so if we think the patient might have COVID, then they'll get directed to the tent. And if they're healthy, they're walking, talking, no issues, they can get a chest x-ray if necessary. They'll get any necessary prescriptions, and they'll be treated and released right from the tent. And I think that's going to really help improve the workflow. One thing I want to remind people is that Christ Hospital, the other hospitals at CarePoint, we're not testing centers. Testing centers are coming online in different counties, but we're not a testing center as of this time. So the tent is exclusively for ER patients. Lastly, I want to remind people when to go to the ER, because we get that question a lot. So basically, if you're sick with something where you normally would not go to the ER, then don't go to the ER. That recommendation still stands true today. But if you are sick with something where you normally would go to the ER, then seek medical attention. You can also call your primary care physician as well. And lastly, we're sort of in two fights. We're in a fight with the virus, but we're also fighting fear. A lot of people are fearful of the unknown. And I want to tell people not to be fearful, because we know how the virus spreads. It spreads when you contact your mucous membrane. So if your hands touch your mucous membranes, that's how you get it. Your mucous membranes are in your mouth, your nose, and your eyes. So it's super important to practice good hygiene, and so you don't have to be fearful, because we can prevent this. Thank you.